Good afternoon, everyone. My name is Chitwarodom. My abstract topic is prebiotic supplement for elevating Parkinsonism development in MPTP mice model with my advisors, Associate Professor Saknan Phongpanpuk-Phakdi, PhD, and Associate Professor Tassinat Desiabut, PhD, MD. So today's presentation will cover three main parts. The first one is introduction. I will tell you why this study matters and the basic background knowledge contributing to my study. The next part is about objective. I will tell you the primary objective of this study. And the next one is about how to conduct the experiment to achieve this objective by the method parts. So let's begin with the first part, introduction. Do you know that Parkinson's disease is currently the second most common neurodegenerative disease worldwide, only lower than Alzheimer's disease? And with the fact that its incidence increases by age, as you can see here from two graphs I show you in this slide, that the incidence and prevalence of Parkinson's disease increases by age. So in a near future aged society will tremendously be affected by this fact, including in Thailand, which we definitely going to be an aged society within 10 years. So Parkinson's disease will definitely be a huge burden in public health society aspects. Let's review the symptoms of Parkinson's disease. The symptom of Parkinson's disease can be divided into two main groups: motor and non-motor symptoms. Motor symptom can be divided into four main criteria, which are bradykinesia, rigidity, postural instability, and tremor. And non-motor symptoms can be many things from head to toe, as you can see here on the slide, that it can range from psychiatric symptoms like anxiety, depression, cognitive impairment, sleep disturbance, to other systems like cardiac dysarrhythmia, autonomic dysfunction, poor GI motility, and sexual dysfunction. So it can be from head to toe. Now we do understand the pathophysiology of Parkinson's disease. This is caused by depleted dopamine, which is one of our neurotransmitters in neurostral pathway, which help polishing movement to be smooth. The depleted dopamine caused by neurodegeneration of dopaminergic neuron in the part of the brain called substantia nigra compacta, which is a part of neurostral pathway. This phenomenon caused by something called Lewy body accumulation, which can cause neuroinflammation and neurodegeneration accordingly. From the biochemical and molecular pathophysiology of Parkinson's disease, as mentioned, the current treatment of Parkinson's disease is levodopa with carbidopa, which can supplement the dopamine in neurostral tract and extrapyramidal tract. But the side effects of levodopa and carbidopa are inevitable, such as anxiety, depression, sleep disturbance, cardiovascular effects such as arrhythmia, orthostatic hypotension, or even GI side effects such as anorexia, nausea, vomiting. As you can see here, the side effects of levodopa with carbidopa are similar to the non-motor symptom of Parkinson's disease. So we can speak that levodopa and with carbidopa, which are the treatment of Parkinson's disease, can also cause the side effects which are non-motor symptom of Parkinson's disease. And that can be a problem, as you can see there. Do we have any other option of treatment? The answer is yes. We have any other option of treatment. There are not only one pathophysiology of Parkinson's disease. Apart from the Lewy body in dopaminergic neuron in the brain, most of dopamine metabolism does not occur solely in the brain, but gut-brain axis plays an important role here. Gut microbiota affects the dopamine level in central nervous system by its metabolite called short-chain fatty acid, including butyrate. But how this metabolite affect the brain? It starts from gut dysbiosis, which means that the gut microbiota change from its equilibrium. Some dominate and some are diminished, gut dysbiosis can lower the level of its metabolite, which are short-chain fatty acids, including butyrate. The lower level of short-chain fatty acid increase gut permeability, which means that it allows more metabolite to the circulation, including the toxic one. This toxin can travel from the gut to the brain, crossing blood-brain barrier, and then induce neural inflammation by activating microglia cell, and then cause neurodegeneration in the area of extrapyramidal tract, which can cause Parkinson's disease. Now we do understand other pathophysiology of Parkinson's disease apart from the Lewy body one. If we can reverse this process, we can find a new option of treatment of Parkinson's disease, starting from increasing the gut integrity, which means that the gut can hold itself together, not allow toxin or any metabolites travel from the lumen into the circulation. So less neuroinflammation and less neurodegeneration accordingly. As you can see here that it can definitely slow down the process of Parkinson's disease. So in conclusion, if we can increase the gut permeability, we might be able to slow down the progression of Parkinson's disease by understanding this pathophysiology. But how can we increase the gut integrity? We can increase the gut integrity by gut integrity enhancing prebiotics, which is oligosaccharide. This substance can be metabolized by gut microbiota into short-chain fatty acid, which can reverse the pathophysiology as mentioned before. So the gut integrity increases and the progression of Parkinson's disease slows down. But how do we know that this experimental design could work? Do we have any evidence to support? Yes, we have. There are one study conducted in mice showing that the oligosaccharide intake can elevate the level of short-chain fatty acid in serum, especially the fructooligosaccharides FOS and galactooligosaccharides GOS after 14 days of intake, 20 milliliters per kilogram per day of oligosaccharide, as you can see here from this table. And another study also showed that the butyrate, or one of the short-chain fatty acids, can inhibit neuroinflammation and elevate motor symptoms of Parkinson's disease in MPTP-induced mice. This study also showed that dopaminergic neuron damage and microglia activation also decreased by the sodium butyrate intake. So if we combine the findings of these two studies, that oligosaccharide intake can increase the short-chain fatty acid in gut, and increased short-chain fatty acid can increase gut integrity and slow down the neurodegeneration and neuroinflammation, and definitely slow down the progression of Parkinson's disease. So now we can hypothesize that the intake of oligosaccharide can also increase gut integrity and slow down the progression of Parkinson's disease. And next, here is the objective of this study. The primary objective is to determine the effect of prebiotic supplement, FOS, on the Parkinson's symptoms of MPTP-induced Parkinsonism mice model. Next, I'm going to show you how we can conduct the experiment to achieve our objective, as mentioned. First of all, there are many substances such as 6-OHDA and paraquat that are used to induce Parkinsonism. In this experiment, we use MPTP by injection it intraperitoneally, together with oral intake of probenecid to lower the inevitable systemic side effect of MPTP, which can be lethal to the mice. We use adult male C57BL/6 mice as an animal model because this strain and this gender of the mice can tolerate the MPTP toxicity more than others. There will be 5 groups of mice. The first group acts as an negative control, which will be fed only by the normal saline by gavage, as you can see here from the green arrow. The other group will be injected with MPTP, which is a dopaminergic neurotoxin inducing Parkinsonism. We inject the mice twice a week for 6 weeks with probenecid. The second group will be fed with normal saline. The third one will be fed with fructooligosaccharides or FOS. And the fourth one will be fed with levodopa. And the last group will be fed with levodopa together with fructooligosaccharides. And then after 6 weeks of experiment, all mice will be tested by a number of behavioral tests, such as open field tests, which can evaluate motor symptoms and anxiety of the mice, and PO tests, which can also evaluate the motor symptoms of the mice, and elevated plasmase, which can also evaluate the anxiety of the mice. So as you can see here that we can evaluate the motor and non-motor symptoms of Parkinson's disease in mice. And after the behavioral test, we will sacrifice the mice by isoflurane to collect feces, intestine, and brain. The feces will be analyzed to evaluate short-chain fatty acid level by gas chromatography technique and do the gut microbiota analysis. And then the intestine, specifically the jejunum part, will be extracted to do a real-time PCR of the tight junction-related genes like claudin or occlusion genes. And next, the brain will be examined by immunohistochemistry technique to evaluate the dopaminergic neuron viability and microglia cell activation, which can imply neurodegeneration and neuroinflammation, respectively. So overall, we will have a result of motor and non-motor symptoms of Parkinson's disease. We will have short-chain fatty acid level in the feces. We will have the level of expression of the tight junction-related genes and the markers of neurodegeneration and neuroinflammation, which means that we can track the change of the mice from the beginning, from the biochemical level of pathophysiology to like short-chain fatty acid level to the clinical presentation of the mice, which is the symptom. And after we collect the motor test, the non-motor test, stool collection, intestine, and brain pathology, we will compare between these 5 groups. And you might have a question, what is the importance of the levodopa and the mixed group? The first 3 group is pretty straightforward because we want to know the effect of fructooligosaccharides, so we have to compare with the negative one and the one without fructooligosaccharides. But we do have the group of levodopa and levodopa with fructooligosaccharides because we use the levodopa group to be a positive control to compare whether fructooligosaccharides can alleviate the symptom as good as or at least not worse than the gold standard of treatment, which is the levodopa. And the last group, levodopa plus fructooligosaccharides, is used to examine if there are a synergistic effect between those two combined between the standard treatment, levodopa, and our possible supplement, fructooligosaccharides. So this is my plan of proposed experimental design. In the near future, if this plan go to be successful, I will definitely update my results to all of you again. So today, before I end this presentation, I have one take-home message for all of you. If we look further from this abstract I present to you today, what can we apply this knowledge to our current Parkinson's disease patients, and how? Thank you so much for your precious time and attention.